Here's a brief warm-up and reminder introduction to CPOE in anticipation of go live next week. After you select your patient, you'll go over to the order section here. This is a reminder to make sure you're placing orders on the right patient. It is possible to do that. You may not believe that right now, but it is worth paying attention to this, both the patient's name as well as some of the other information associated with them, to make sure you don't waste time placing orders on the wrong patient or potentially harm somebody. Once you've confirmed that you have the right patient, you go on into POM. As an ED doc, you're going to want to go down to the ED order sets here. We do have very many of these, and you'll see that they are clustered into sections that are hopefully useful to you. So here's a section that has different antibiotics for different clinical conditions. You don't have to use those, but I think it makes it easier to choose the right thing. You see we have a couple of abdominal pains here. The rest of them are largely alphabetical according to the major noun or adjective that you're interested in. You'll see that there are 3 for diabetes, both severe hyper syndromes, a general one for kind of a hodgepodge of diabetic issues, as well as hypoglycemia, one for lower extremity, one for upper extremity, some convenience ordering for labs. There will only be one in real life for point of care testing. In the medication section, again, you can compose these on the fly if you want to, but typically it's a little easier if you know where they are in these sets, and you can do one click instead of a dozen or more. The drips are particularly hard to compose on the fly and are pre-built with kind of starting rates, and you can go in and adjust the protocols. There's the standard pain and nausea set, as well as the high-risk order set that has lower doses for patients who are more likely to have complications. Procedurally oriented order sets below that. Radiology order sets, mostly categorized according to body area, lower extremity, upper extremity, neuroimaging, spine, but then as well as modality, here are some ultrasound sets, and then this is the electronic equivalent of the paper protocol set. Couple for sepsis, mild versus severe, and the severe order set is a very comprehensive one, and if you were just going to go look through one thing, I would say that might be a good way to browse through an order set to get a sense for all the different categories. And there are also some subsets in there for fluids, antibiotics according to disease condition, as well as vasopressors. This is the TPA order for stroke. This is the order set for stroke. And then down at the bottom, these are the standing orders that nurses will use for very specific clinical scenarios prior to your seeing the patient, and are the equivalent of what used to be called the nursing order guidelines. So I encourage you to go through, get familiar with the different order sets that are in here. You can also use the search bar. So rather than remember where things are and scroll down searching for them, you can search here, ED antibiotics, and it trims it down for you. The problem with the search bar is that it only identifies things in the exact order you're typing. So if you were to type in ED UTI, it wouldn't identify the antibiotics. So what I would encourage you to try if you are using the search bar is just to type in the key word rather than ED and worry about what the second word is. If you do that, you'll see though that you do access order sets other than in the emergency department. So this is for the urology set, the complicated urinary tract module that's intended for the inpatients. So anyway, I hope that you will go through and get familiar with the order sets as they are arranged in the library, as well as practice a little bit with the search bar. More to come.